I'd like to take just a few minutes to discuss the subject of common mistakes made with Medicare. Mistake number one, choosing a plan without at least having a basic understanding of what Medicare is. I think most people understand that Medicare is made up of 4 different parts, A, B, C, and D. But there are also other things that you really need before choosing a plan. You need to understand what is a supplement versus an advantage plan. What is in-network versus out-of-network? What is a maximum out-of-pocket? All the deductibles, all those kind of things that come with these plans when you begin to choose them. Mistake number 2, postponing enrollment. Again, most people understand that at age 65 you should be enrolling in Medicare. But there are time frames involved in it. How long before can you enroll? How long after can you enroll? What about if you decide to work past the age of 65? Is there an enrollment period for that? There are time frames for each one of these scenarios. And if you miss those scenarios, you could have penalties that are permanent when it comes to Part A or Part B and Part D. Also, you could miss out on the opportunity to get a supplement without having to go through underwriting. So it's important to understand when to enroll and actually going through with that. Number 3 mistake, renewing without reviewing. This happens every single year. Around September, the end of September, 1st of October, you'll be getting letters called ANOC. That is the annual notice of change letter from your particular carrier, your particular insurance company. They send them out every year, and within that letter they describe the plan that you're on. Let's say for 2024, what changes are going to be made when it comes to 2025. And I can guarantee you that with Advantage plans, there are going to be changes. There could be changes in the formulary where your prescription may not be on there next year. There could be changes in the maximum out of pocket, changes in co-pays and co-insurance, changes in what's covered and what's not, other kind of benefits that are within the plan. So I would highly suggest that you sit down with a broker, someone like VineBridge. That's what we do. That's probably one of the most important things we do around here when it comes to helping people with their Advantage plans every year, and that is sitting down, looking at it, reviewing it, and then comparing it to other plans to make sure that you're getting the best benefits for your particular situation. And we do it for free. We just sit down and talk with you about it and help you through it. Mistake number 4, neglecting to look deeper. What I mean by that is you have to make sure that your doctors are in network, that your prescriptions are on the formulary, and that there are multiple providers in your area. These are important things. If your doctors are not in network, it's going to cost you more money. If they are not in network, then you may end up having to change doctors. I just got a call today where that situation took place with someone who was trying to figure out why their insurance wasn't covered. They were going to someone who were out of network. Number 5, not asking about out-of-pocket costs. This also can hurt you. I don't know a whole lot of people that just like throwing money away. So you need to check that particular plan that you are looking at and make sure of what the out-of-pocket costs are, the co-payments, the co-insurance, the deductibles. Is there a deductible on prescriptions? Is there a deductible on the medical part of it? What about a MOOP? You know what a MOOP is? Maximum out of pocket. Understanding what that is. Mistake number 6, selecting the wrong prescription plan. Remember, once you choose these plans, you have them until the next enrollment period. There are only certain times of the year when you can change plans. So you have to make sure that your prescriptions are on the formulary. Not only that, but that your prescription is on a tier that's not going to cost you a lot of money. It may be on one and there's nothing you can do about it, but there are some times when you can go through the different companies and find your prescription on a lower tier, which means a lower cost. And number 7, missing out on financial support. The state of South Carolina has financial support for those who have a limited income. And that financial support could help pay for premiums, could help pay for co-payments and deductibles, prescriptions even more. So you need to look into that and make sure you ask those questions. Again, VineBridge Connect, that's one of the things that we love to do, sitting down with people and going over their plans with them, making sure they're on the right plan for their particular situation, and just building bridges of relationships. So we'd love to sit down with you. Come and see us. Well, our number and our address is down below. If you don't mind, click that subscribe button and follow us, and that way you can get the updates as we put them on YouTube.